Hello, I'm Dr. Mazhar Hussain from My Hair Clinic. If you're considering having a hair transplant, you of course want to have the best possible results, you want fast growth, and you also want fast healing. You would want to put your body in a healing mode, and I want you to adhere to our pre-surgery instructions to maximize the chances of a speedy recovery and good growth. So, as soon as you decide you want to have a hair transplant, I strongly suggest you stop smoking, or at least reduce smoking as much as you can. You should also avoid inflammatory lifestyle of food, alcohol, caffeine, if you're living a very stressed life, if you're not sleeping well. If you take processed foods, if you take saturated fats, they can all cause inflammation and delay your healing, delay your results. You can also try to ensure you get sufficient micronutrients by taking 5 to 7 servings of fruits and vegetables per day. If you're diabetic, you should avoid fruits with a high sugar content. You should also try to ensure you have sufficient micronutrients. I suggest you take 5 to 7 servings of fruits and vegetables daily. If you're diabetic, you should avoid fruits with a high sugar content. Apart from that, we will recommend you a number of supplements that can help you in your recovery and help you get faster results. We'll inform you on how to take them and when to take them. 7 days before the surgery, I want you to stop blood thinning medications and supplements. If you're taking any prescription medicines, you must speak to your prescribing doctor to see whether or not you can stop the medicine. Of course, you need to inform us if you're taking blood thinners and your doctor is not allowing you to pause it. You should avoid medicines like NSAIDs, non-inflammatory drugs, non-steroidal anti-inflammatory drugs, for instance, diclofenac, naproxen, ibuprofen. If you're using minoxidil for hair loss, you should stop minoxidil 1 week ahead of the surgery, and you can resume 2 weeks after the surgery. Finally, you need to take blood tests for HIV, hepatitis B, and hepatitis C, and send the results to us before the surgery so that we know what your status is. On the day of the surgery, you should wash your head with Hibiscrub or Metiscrub. It's a medicated soap. You stand under the shower, wet your head or your beard, chest, belly, private parts from wherever we are going to operate or take your donor area from, and from wherever we're going to implant it. You need to rinse the body properly, and then you apply Hibiscrub or Metiscrub. You rub it in well into the skin, leave it on for 3 minutes, rinse it off, and then repeat the procedure. Apply Hibiscrub and Metiscrub. Leave it on for 3 minutes and then wash it off. Use a clean towel to dry yourself. On the day of the surgery, you can have your regular breakfast. This is in local anesthesia, so you don't need to worry about eating. You should not be taking supplements on the day of the surgery. Make sure to bring a button-up shirt that you can wear after the surgery so we don't have to pull anything above your head, which could potentially dislodge your grafts. After the surgery, we still recommend you don't smoke, or at least you do not smoke for the first 4 months after the surgery. But preferably, you should not smoke at all. If you're not able to, reduce smoking. You can resume your supplements. Again, take 5 to 7 servings of fruits and vegetables, and take the supplements that we recommend.